Presenting treatment plans to patients seems like this daunting, nerve-wracking process because you think you have to sell the patient on treatment. Hopefully after watching this video, I can change that perception. This video is for you if you are the doctor, the treatment coordinator, the office manager, or anyone involved in the front desk administration who may be responsible for presenting treatment plans to patients. I'll be splitting the topics of presenting treatment and presenting finances into two separate parts. For this video, I'm going to focus on presenting treatment, and the next video I'll get into presenting finances. Also, I'm not going to get into the clinical aspects of treatment planning. I'm going to assume that the doctor has already done the diagnosis, there's a treatment plan in place, and now it's time to present it to the patient. Okay, so let's get started. If you're the doctor presenting your own treatment plans, like I do in my own practice because I don't have a treatment coordinator, the presenting of the treatment plan happens after you've gone over clinical findings with the patient. Once the diagnosis has been completed for the patient, the presenting of the treatment happens after you or your assistant have entered the treatment plan into the practice management software and have also sequenced the treatment. For treatment coordinators and other office personnel, presenting of the treatment is going to happen either in the operatory once the doctor and or the hygienist have left the room, or you may have a separate consultation where you present treatment plans. Wherever it is, make sure the treatment plan with procedure codes as well as the sequence of the treatment is entered into the practice management software. If there's any intraoral photographs that were taken for the patient, make sure you can easily access them while you're presenting treatment plan. When the patient is in front of you, ready to have the treatment plan explained to them, there should be absolutely zero distractions. Everything needs to be easily accessible from the computer you're presenting from, including the treatment plan with procedure codes and the sequence of the treatment, intraoral photographs, if available, if you have before and after photos of the treatment that you can be presenting, or anything else you may need to show the patient to help them understand the treatment they need. Keep a folder on your computer where you can access photos for things like different conditions like broken teeth, implants, perio condition, etc. If you're going to be accessing the same computer each time, I would just make a folder. Or if you're going to be presenting from different rooms, let's say, you could have a folder in the cloud like Google Drive or Dropbox where you can easily access it from any location in your practice. Let me tell you why this is all important. Imagine the doctor or the hygienist has just finished going over clinical findings and letting the patient know what they need. Now, a patient is going to walk to the front and meet the person who's going to be presenting treatment. Now, don't expect the patient to remember everything they were just told in the operatory. So that's why it's important to bring pictures up while you're presenting treatment. But that person presenting the treatment doesn't have access to photos because they're still sitting on the SD card. Now that treatment coordinator has to go back to the operatory, let the assistant know to transfer the photos from the SD card to the patient's chart. Okay, all these little steps matter. All these steps takes time. And this is all happening while the patient is waiting at the front in the middle of discussion of treatment. So it kind of breaks their chain of thought. It's a distraction. Where do you present treatment? When going over a treatment plan with the patient, make sure to do it in an area where the patient is comfortable. Patients should be seated. Don't have the patient standing in the front desk checkout area and your treatment coordinator kind of leans in and is going over the plan with the patient while there are other patients waiting in the area. It doesn't have to be a closed room, but if your front area allows, don't do it where there are other patients. Now let's get into the specifics of going over treatment with the patient. Before you start to present treatment to the patient, make sure you've spoken to them. Make sure you've gotten to know them a little bit. Don't expect the patient to understand everything you say. So pause and ask questions. Actively listen and notice their body language, their apprehension, their hesitation, their anxiety, etc. Maybe you need to further address their objection to treatment. That objection may be fear. Fear from a previous bad experience or an experience of a friend or a relative who may have had the same procedure. Getting context is important. Here's what I mean. When you're explaining to the patient they need a crown for their large leaky amalgam restoration, you're going to explain to the patient that they should move forward ASAP before the tooth breaks and turns into a root canal. Explaining why the treatment needs to be done in a timely manner is important. Patients often ask, can I do this in 2 months when I get back from vacation? You can't make the decision for them, but it is your job to explain the risks of waiting. So yes, we want the patient to move forward with treatment as soon as possible, but what about the patient who's at that lower left molar number 18 missing for like 20 years? You're not going to be able to say, if you don't replace that missing tooth, X will happen. From the patient's perspective, if in 20 years of that missing molar, if nothing has happened, you telling them that they need to move forward with treatment ASAP is really not going to do anything to drive them forward to getting anything done. Using dental analogies. We all know that avoiding dental jargon is probably the best thing you could do as you're going over treatment with patients. But using dental analogies is going to help them understand what's going on in their mouth. Once you've gotten to know the patient a little bit, you can ask them what they do for a living. Many times patients just tell you because it comes up in conversation as they're telling you about the earlier what happened in their day, the week, etc. So if you're actively listening, Keep this information in mind. And if you can somehow relate the treatment they need to their line of work, they're going to be able to better understand the treatment they need. And if they understand the treatment they need, they're more likely to move forward. When I'm explaining why a patient needs SRP, I don't say periodontal treatment, I don't say gum disease, I say gum infection. I mention words the patients themselves use to describe their gums. You often hear patients say things like, well, my gums bleed when I brush my teeth, or they hurt in certain areas when I floss. When explaining why patients need bone grafting, I don't say things like bone preservation. Instead, I let them know that by placing bone into where the tooth was, you're preparing it for future implant. To make sure there's enough scaffolding and support around that future implant, you have to place graft material. Otherwise, there won't be enough support for that implant and it can fail. Instead of going over all the dental analogies in this video, I've put together a helpful PDF file with a list of dental analogies that I use on a daily basis in my own practice. You can download this PDF by going to the link that I've posted below this video. Whenever I present treatment plans, I always believe in following a simple framework for consistency. Ideal treatment plan is always a combination of your clinical findings as well as the patient's perceived need for treatment or their chief complaint. If you follow this framework consistently, you're going to become better and better as you practice and improve on this. Here's what I'm talking about. To address the state their complaint, from/due to, state cause, state the treatment option, will be an ideal option to state what the treatment achieves, so you now state the perceived need. I made this diagram available in the PDF that I mentioned earlier, along with the dental analogies. So you don't have to remember this, but you can come back to it by referencing the PDF. You don't have to use this sentence in the same exact format, but however you're going to say it to the patients, it needs to include the following points: their chief complaint or their perceived need, what caused the issue, treatment option, what the treatment achieves, and what does the treatment feel like or look like for the patient. One of the other critical aspects of presenting treatment to patients for every dental practice is making sure the entire team is trained on explaining dental procedures to patients. I can say this with 100% confidence that in most offices, there will be team members that are not able to explain the importance of a dental procedure to a patient. And this is true whether they're part of the clinical team or the front desk team. This happens all the time, especially when you're diagnosing a perio patient who needs to come in for an SRP, but instead are scheduled for 6-month prophies. So when the team members aren't trained or are unaware of the importance of dental treatment for the patients, they're going to follow the path of least resistance. What that means is they're going to opt to avoid this whole conversation of explaining to the patient in the fear of either upsetting or losing the patient. The only way to fix this is to role play with the team. Train your team not just on how to explain dental treatment to patients in layman's terms, but to also address patients' objections to moving forward with dental treatment. When presenting treatment, or even at the end of the presentation, you should be asking patients questions that require them to think a little bit, all right? Avoid asking close-ended questions to which the patients can just answer with a simple yes or no. Avoid questions like, do you understand? Or any questions? Most patients will just say yes, just to avoid the conversation when they really don't understand what you've just said. Instead, what I ask is this: knowing all the risks of all the things that are recommended so far, what's stopping you from getting this done? All right, so just to close this out, just want to briefly summarize a few key important points. Remember, an ideal treatment plan is always a combination of your clinical findings as well as patients' perceived need or their chief complaint. If you follow this framework consistently, you're always going to get higher case acceptance rate with patients. Don't take things personally. Just because the patient doesn't move forward with treatment now doesn't mean they will never move forward with it, all right? I've had patients who move forward with major treatment after 2 or 5 years after I've recommended it. What is important that you reiterate and re-emphasize the importance of the unscheduled treatment at their recall visits. And finally, remember the goal is to make sure the patient has a scheduled appointment for treatment that you've recommended. If they don't have any appointments scheduled, you need to make sure your team is following up. So make sure your team is setting up follow-up reminders. If you're using Teamio, you can do this easily via their patient profile page by looking up a patient and setting up a follow-up, or from the unscheduled treatment page and setting up reminders that way so your team knows exactly who needs to be followed up on when they log in. And that's it for today, guys. Continue tuning in, and in part 2 of this series, I will get into how to present finances. Take care.